Greetings and welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast. Joining us on this episode are two guests from Carilion Clinic, Tammy Mitchell, who is the nursing unit director for what's known as the Hope Floor at Carilion Roanoke Memorial Hospital, and Erin Casey, who leads the Peer Recovery Specialist Support Program at Carilion. With these two ladies, we're going to chat about a successful approach on a hospital unit at Carilion that's helping patients struggling with addiction issues and helping improve staff retention and satisfaction. Before we get to that, though, let's welcome our guests to the program. Thanks to both of you for being with us today.
Glad to be here.
Happy to be here.
And we're happy to have you as well. Let's start with you, Tammy. The Hope Floor is a unit at Carilion Roanoke Memorial on 5 West. A few years ago, it experienced some challenges managing patients, many of them from disadvantaged backgrounds, who were admitted for treatment of a medical issue that perhaps was inflamed by underlying and often habitual addiction and substance abuse. These conditions, combined with some visitation policies and other factors, created a difficult environment for patients on the pathway to recovery and staff overseeing their care. As I understand it, to address that, some new protocols have been established to help these patients get on the road to recovery. So, Tammy, if you would, just sort of please share your insights and some of the background about life on the Hope Floor and where things were and how they've changed for the better.
Sure. We have 26 beds, and we do have some minor surgical stuff, but mostly medical. We were seeing a big trend of patients with IV drug abuse, and they were hostile and angry and demanding and non-compliant, and we hadn't been trained in that. And, we're just your regular run-of-the-mill med-surg nurses, which, we do a little bit of everything, but we weren't too familiar with behavioral health stuff. And it was frustrating for the staff because they felt like, well, they're here, a captive audience for 6 weeks because of the long-term antibiotics, but we're not doing anything to help them with the behavioral part of their treatment. So we started to do some self-imposed rules and things to see if we could get a better handle on basically the abuses that were taking place, and weren't having much headway. The staff was starting to turn over. Some of my staff had been with me for 20 years at a different facility, and they came here when I came here. So it was frustrating, real frustrating. We started to learn a little bit more. We had some educational things, and we had a lot of support from administration. There were some security issues that needed to be dealt with. And after we started implementing some of the safety measures with visiting hours and visiting visitors' belongings and things, the staff started to feel a little bit safer, and they felt like they had a little bit more control. So that was sort of the beginning of what we tried, and we're still trying to patch it up from what we learned with each patient.
And the name, the Hope Floor, how did that come about?
We had a couple of patients who actually told us, this is the first time I've actually felt hope. This is the first time I've been treated like a human in a hospital, which was just shocking to me, that they had not experienced a hopeful environment. So we just started calling ourselves that based on patient feedback.
Well, and that's great feedback, and I think a testament to the work that you and your team are doing. And I think it's also interesting perspective that you share. I think a lot of people sort of from the outside may look at hospitals and sort of see them as places where patients receive care, but they may not always recognize or be aware of the fact that the staff that's providing this care sometimes is doing so under challenging circumstances just because, as you said, some of the patients are coming in with some real underlying issues or some behavioral issues or might be disruptive, and that can make the task of the frontline provider a little bit more difficult. And so I appreciate you and your team really hanging in there and giving that hope to patients.
Thank you.
Out of that environment, from what I understand, and the recognition that many of these patients, due to their medical needs, as you said, Tammy, would be hospitalized for an extended stay, and that presented an opportunity to try to get them into recovery. And so, Tammy, your clinical staff worked with behavioral health professionals who specialize in addiction treatment And you folks have banded together to help these patients try to break this cycle of addiction. And I guess that's where the peer recovery support program comes in, which involves both trained clinicians and other folks, as well as people in recovery themselves who are trained to help patients seeking to break away from substance abuse. So, Erin, if you could, as the leader of the peer recovery support program, explain the steps and the processes of this voluntary program that's available to help these people free themselves from addiction. And these are people that are on the Hope floor on 5 West.
Sure. So our peer recovery specialists, they go through the training that's done by the Department of Behavioral Health and Developmental Services to become eligible to participate. So they're people in recovery who've received a special training. And we started working with the Department of Behavioral Health and Psychiatry at Carilion several months before the 5 West issue came to our attention. And we were approached by psychiatrists and a clinician who were very involved on the floor. And they asked us, if we could collaborate with them and the nursing staff to meet the patients where they were. Because I think one of the things that we see that's most powerful with the peers is that they're able to go into a room and build instant rapport with patients who are really struggling because they've been there and done that and lived it. And so we're finding that the peers are really able to reiterate a lot of what the recommendations are from the clinical staff, but also are able to reach them about, what's going to happen after they leave the hospital, what services, are they going to follow through with, and how can we support them in not only staying the entire 6 weeks to receive their medical care, but also continuing the path to recovery. And I think that's a really powerful thing because we're looking at this hospital stay for a lot of patients that, had no intention of going to rehab or seeking substance use help as an initiator for long-term care. And I think that that's a role that the peers play, is walking them through those steps during the hospitalization and post-hospitalization.
And some of those steps, if I understand correctly, include things like individual and group therapy, music therapy. I guess there's a spiritual component as well, journaling, some other things. Can you talk about some of the elements of the program that people in this program go through?
Sure. So everyone in this program, they work with a psychiatrist, an addiction-certified psychiatrist for medication management. They work with a licensed clinical social worker who runs groups 3 times per week. And then they also have 3 sessions per week with a peer recovery specialist who comes and meets them in their hospital room and works with them on a whole number of things. And the opportunities for therapy in all of those situations are really high because we're able to, one, engage them while they're there, but then introduce them to new skills and new ways of expressing themselves and things that are going to last them for a lifetime.
And at this point, how many folks have successfully gone through this program?
Tammy, I think that's probably a better question for you.
I don't have those numbers in front of me, but it's upwards of 30.
Okay.
And this is since July. We've had probably 75 people pass through the program. Some stay in the program, some complete it, some leave before their treatment is completed. But, and that's tough for the staff too, because they feel like somehow they have failed if someone doesn't complete. And so what I try to help them understand is sometimes we're just planting seeds. We're giving them tools that they didn't have before they came to us. And we just never know what seeds are going to fall on, fertile ground. And, we won't always be around for the harvest. But, that's our job right now, is just to make sure that we're getting them as much information and support and help as we can while we have them.
Just to follow up on that, I think that there's about 30 patients that have completed the pathway, or the HOPE pathway that we're talking about. But I think that, one of the things that the peer recovery specialists do is that, stay in contact with a lot of patients that don't even necessarily complete. Maybe they got moved to another floor, or they left against medical advice because it was really hard for them to stay in a hospital for that period of time. But one of our goals is to, regardless of whether someone completes the pathway, the program, or not on 5 West, we're able to still maintain those connections with them so that we can, when they're ready to get help, or when they're ready to start that recovery process, we can then, help them right then and there.
Well, it sounds like a difference have been made in a lot of lives. And Tammy, I like the sort of planting metaphor that you used, because I think that is sort of evocative of what we're talking about here, which is sort of new life springing forth and germinating through this program. So I think that's a great work that you're both doing.
Great.
At the outset of this conversation, I alluded to the fact that this work has had benefits for patients as well as hospital staff. Tammy, I wonder if you mentioned it as well, about some of the challenges that this patient population had posed for some longtime staff that you'd worked with. Are there any numbers or statistics that bear out, in addition to the benefit for patients, the benefits that you've seen in terms of staff satisfaction and retention?
Absolutely, absolutely. We started this program in July of last year, and so I compiled a retention rate, turnover rate, and vacancy rate for last fiscal year and for this fiscal year up to this point. So last year we finished out at a retention rate of staff of 69.85%. This year we are at 100% this far. The turnover rate has gone from 31.7% to 4.72%, and our vacancy rate went from 13.7% to 4.09%. So we have, the staff feel supported. They feel like they're helping. They're not just in there giving medicines and, they don't have anything to work with. They connect with patients now. They feel success. They feel like they're really doing something. And I think that the retention rate at 100% for a med-surg floor is, with this population, is phenomenal.
Well, I think those numbers are hard to argue with, so congratulations on those results. Before we go, I would like to close with a question that we ask our guests on the VHHA Patients Come First podcast, and it's one that we borrow from a popular BBC program. And the question is this: if you were stranded on a deserted island, what one book and one album would you take with you? And we will spot you a copy of the religious text of your choice, so Bible or otherwise. So other than that preferred religious text, what one book and one album would you take with you to keep yourself occupied? And Erin, we'll start with you.
So the book that I would take is The Wounded Healer by Henry Nouwen. And I take that because right now I've read it like 3 times most recently, but that's one of my favorite books. And then an album. Do you want both?
Yes, please. Okay.
An album that I would take. Honestly, I have like a mix, like an inspirational song mix playlist, so it would be hard for me. I'd want to burn a copy of that.
A mixtape is a perfectly acceptable response, as long as it's album length.
Yeah.
Is there one song in particular that would be on that mixtape or that playlist?
Probably the Fighter song by Katy Perry.
All right, and Tammy, what about you?
Well, I would probably, being a person of faith, like everybody else, most everybody, I would take the Bible. And musically, I would take a copy of anything by Hillsong Worship out of Australia. But my favorite song is also from Hillsong, and it's called Healer. And that song has just a real powerful message for me. So that's what I would like.
Okay. Well, one chose a book about healing and one chose a song about healing. So I'm sensing a consistent theme here. Well, listen, I do want to thank you again for making some time to be with us today, and that is going to do it for this episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. So thanks again.
Thank you so much.
Well, that's going to do it for this episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. You can listen to this episode and previous episodes of the podcast through SoundCloud, Blueberry, or online at www.vhha.com. You can also send us questions, comments, feedback, or suggestions about future podcast episode guests using the email account pcfpodcast@vhha.com. Again, that address is pcfpodcast@vhha.com. We also encourage you to connect with us on social media, including Facebook, Twitter, LinkedIn, and Instagram. You can contact us through Twitter using the hashtag PatientsComeFirst, and our Twitter account is @VirginiaHHA. Thank you.